As you can see, we are decked out in our Soothie outfits. Hopefully we'll have more Soothie news.
Yeah, we got some soothiness.
All right.
Today we're reporting 1,700 new cases per day.
Sunday was actually the first day that we had less than 1,000 countywide positive tests since around April.
We're right now at around 80 patients who are currently hospitalized and have a positive COVID test.
The numbers are all doing the same thing that they've been doing. We have not had an admission due to COVID in something like 5 days now. From the 2 prior years, the cases will remain low until the winter, and they will likely rise. But at that point, hopefully, will remain not terribly severe because each successive wave has become less and less severe.
A number of school districts that have indicated that they're struggling, telling people that if they've had an exposure, you go ahead and wear a mask for 10 days. This aligns with the guidance from CDC and the guidance from the state. It's just here in LA County, it is a requirement.
You told me that the close contact policy is linked to the mortality rate. What's the difference between the science that you follow versus the other local health directors who choose to align with the state and allow school districts to choose?
I think where there's perhaps a different approach is whether or not that becomes a requirement or whether or not that becomes a strong recommendation. And what we've asked really is for people to put on their masks.
It's already in place countywide as recommended, but only enforced in our schools.
It really is a measure that we can fairly easily implement. So we're very comfortable with that.
What is a low enough mortality rate for you to align your close contact policy with the state?
We don't really have a number in mind.
This is a marketing ploy.
My job is not to be a Soothie
Yes,
and to try and
we
take
usually try to pop
a different viewpoint. But on the other hand, I actually have worn my Soothie shirt because I look at the numbers, we look at the people in the hospital, you know, there's no reason not to be Soothie.
Dr. Holtom, that's pretty Soothie of you.